Okay, so in our last video we talked about heart failure basics and kind of what it means to have heart failure. You got your systolic, diastolic heart failures in which you're not pumping very well. So in this video what we're going to talk about is what that leads to. Clinically, what types of signs and symptoms does heart failure produce. So again, kind of a quick refresher here. Remember, heart failure, you got two problems, and the primary problem is you have a pump problem. And that's kind of essentially the big one. And then the other one is a relaxation or failure to relax or fill problem. We talked about that in our last video. Fill. So either one of these can lead to essentially this backflow of fluid. As we talked about, your ventricle is supposed to be pumping blood out to the rest of the body, and if it's not doing that correctly, or if you're not getting enough blood into the chamber with the lack of relaxation, essentially think of it as a traffic jam. You got a lot of blood flow backing up, and you're not getting enough oxygenated blood to the portions of the body that's necessary. So if we think about it, the heart pumps blood out to the rest of the body. And let's just think about the organs that it primarily goes to. So from a left side of the heart failure standpoint, you pump the blood out and it goes to the extremities, or it goes to the lower extremities, or to the kidneys, or to the brain. And if you're not getting enough blood flow to any of those portions of the body, you're going to have symptoms. And the symptoms are what the patient experiences. So if you don't get enough oxygenated blood to the tissues, you're going to end up with things like fatigue or just being tired because you don't have enough oxygen flowing to the muscles. So fatigue. And sometimes if you're not getting enough warm oxygenated blood to the extremities, this is correlative with the signs that we see when we do a physical exam in the hospital, and that would be cold extremities. So cold extremities. And along these same lines, when people have fatigue, or just generally tired all the time, they try to exercise, and they have this exercise intolerance. So exercise intolerance. Okay. And then if you're not pumping enough blood, say, to the extremities, and then you have this backflow into the heart, it kind of leads up on the left side of the heart over we were talking about over here, and that leads to swelling in the legs. So people end up getting swollen legs. So swelling is a symptom that a patient would come in and complain about. And in terms of signs, what that leads to over here for us in the medical field is called edema. So we're able to classify how much edema people have. And then I guess the biggest one to think about is if you have this backflow of fluid and your heart's not pumping, as we talked about, you got a backflow. It goes all the way back the other way. So if you're not pumping out to the body, it gets caught here in the left ventricle, and it goes back to the left atrium, and the left atrium goes back into the lungs. And if you get a bunch of blood flow or lack of blood flow through the lungs, let's think about this in a different color. Over here in the lungs, your lungs start to fill up with fluid. And when they fill up with fluid, they can't contract as well, or they can't oxygenate as well, because it's more, like we talked about again, a traffic jam. So this type of symptom is called dyspnea. And that is when essentially a patient says, "Doc, I can't breathe," and that's shortness of breath type of feeling. And if you correlate that over here with what sign we would see, we listen on this with a stethoscope, and we tend to hear that fluid kind of rattling around in the lungs, and that's when we get rales or crackles. You often hear that term on TV, crackles. And that is what people have with their dyspnea. Now, another important aspect on that right side of the heart is when you have blood being pumped through this aorta out this way. Again, we have that backflow coming back in here, and see this vessel leading into the right atrium of the heart. It also backflows up this way. And if it backflows up this way, you got these large veins that come back from the head and neck called the jugular veins. Jugular veins. And if you have this backflow, again, you start to see your jugular veins get distended, and that's what we call, let's move this up a little bit here, JVD, or jugular venous distension. So JVD, and that is jugular venous distension, and that's another sign that we see. Distension. And this might be a symptom that the patient may come in and say to us, oh, I got this throbbing in my neck, or swelling in my neck, or a fullness sensation in my chest and neck. Throbbing in neck. And that's essentially what the patient's going to complain about, and that correlates very easily to the signs that we feel with. That's the jugular venous distension. So if you think about it, just what we talked about in the first video, if the heart is failing to pump or failing to relax, it's essentially causing this traffic jam of fluid back through each of these chambers. And this traffic jam leads to not getting enough oxygenated blood pumped out into the periphery, so your muscles get tired, you get fatigued easily, you can't exercise very much, cold extremities. And then if you have that backflow on the right side, it backs fluid up, and it pushes this fluid back here because it's just a backflow, and that leads to the edema or swelling in the legs. And that swelling also kind of presents here in the lungs, as we talked about, and that is what we call pulmonary congestion and pulmonary edema. And that's when you have, doc, I can't breathe, I'm very dyspneic or short of breath. And we listen to people with our stethoscopes and we see crackles. And if you were to look at crackles on a chest x-ray, that's when you have pulmonary edema. If you have a bunch of fluid. So pulmonary edema on a chest x-ray. And those are some signs, clinical signs that we see here. So those are the basic signs and symptoms of heart failure. And you just got to kind of think of it on a basic term. You're just getting poor oxygenation to the tissue as well as a traffic jam of blood flow.